I found the workflow getting around the chart to be very, very easy with those little tabs. It makes it very easy to move from section to section. So that was simple for me. The fact that I could make my own templates rather easily. And one of the really key things for me was the billing. This billing just suits me because I do have a small practice. I really can't afford to have a lot of employees. So at the end of each day, I send out all my bills. And now, over the course of these last 2.5 years, many of the insurance companies send my check directly into my checking account. And through the miracle of WRS, they're even posted in the patient's billing. It's just like a miracle to me because I have no concept of why that works, but I love it that it works. Oh yes, very. And that was another really wonderful thing. WRS was kind enough to have a discount for nurse practitioners. Most of us really don't have huge practices because we practice slightly differently from most doctors. And so the price was very affordable, and that was a huge part of my decision too. Huge, that was huge. I'd been in a server-based one, and if the server goes down, you are really stuck. And then, of course, technology changes all the time. And I obviously am not a computer guru. So the fact that it would be web-based, as I was searching for this and trying to understand what really does that mean for me, realizing that everything is not based on one computer that's in my office, which could die, for heaven's sake. I felt a level of confidence, I guess I would say, that all of my information is held in a server that is absolutely dedicated to this kind of work. It really made a big difference. Well, I knew, yes, before I chose it, and the importance of it, I can't pretend that I understand everything about what is going on in the healthcare industry changes, but clearly certifications matter. In my own personal life, I'm certified as a women's health nurse practitioner, and I'm certified as a menopause practitioner, and that obviously is meaningful. Well, do I want to buy an EMR that is not certified? What would happen then to my getting any of the connections that I might need due to the Affordable Health Care Act? Very important to me. And I did look at some that said we are close to certified, and that did not make me comfortable. Oh yes, I use it all the time. There are no prescriptions without the EMR, really. So the vast majority of my prescriptions are all sent directly through the EMR. Controlled drugs have to be printed and faxed or printed on a special legal paper if the patient wants to actually carry the prescription to the pharmacy, but that's actually quite rare. So they either go automatically through the EMR or it's a touch of the little icon that says print, and it's printed out and we fax it. It's just so amazingly easy. Oh yes, all of the lab reports from our local laboratory come directly into the EMR. Mammograms come directly in, pathology notes. The only time I get any paper coming in is if a patient is seen in a totally different county at a different laboratory that I'm not hooked up to, but virtually all of it comes right into the EMR. Oh, they're very good. They're patient with me, which is really good because I asked an awful lot of questions in the beginning because, computers are not my thing. So they've been very patient. The ticket system, if you have something that isn't terribly urgent, you write what they call a ticket. I just say it's a question, and I get a response certainly within a day. And if it's something urgent, I can call and somebody will talk to me if it's urgent. So I really haven't had anything to be discouraged about in terms of WRS staff. They've been wonderful. Well, I think it was pretty easy, and the fact that there are very clear ways to learn the system that are already in the system. There's videos of how to do this and videos of how to do that, and a manual that's in the system. So when I'm trying to figure out how to make a template, well, it gives you the steps on how to make a template. So it's pretty much foolproof. Didn't even need a piece of paper to learn. It's all in the system, which I think is fabulous. Sadly, it was not very satisfactory relationship, and I had to change computers one time, and there was a big kerfuffle over that, and I was not satisfied with them. I might have continued with them had they developed an ER with a prescription module or something with billing, if I felt comfortable working with them, but I really did not. So WRS is completely different. I feel very confident and comfortable. Yes, I've been on the clinical faculty of the U for probably better than 20 years, so I get nurse practitioner students here. And these students are in a variety of different clinics, and even Madigan Army Hospital clinics, and just everything you could imagine, tremendous variety. And I've had, I think, all of them mention that this was the easiest of all the systems that they've dealt with, which is kind of surprising, really. I mean, some of them have already had 8 or 10 clinical rotations. So I think that's a big plus for WRS, that a student walks in and within just a few instructions just takes off with it. My best thing is that I feel confident with it, and that's huge to me. I understand enough of it that I feel confident, and I feel confident with the company. Yes, I have. I've already gotten incentive money for prescribing through the EMR with Medicaid patients. I got a check one day for some small amount of money, and I couldn't figure out what it was. And fortunately, you can call somebody at Medicare, and they're pretty good about explaining it. And they said, oh yeah, this is your incentive because you've been using an EMR. I was amazed. Yeah, I didn't even know I was going to get it, to tell you the truth. So it was all a surprise to me, because the whole thing is already built into WRS, and it just goes to wherever Medicare lives. When I moved here and got WRS, it clearly freed up a lot of time for me, because even with my old system, when it was the end of visiting patients that day, I was still there. I was still, doing some work, and then, trudge home. And now, if I'm done with my patients at 4:30, I'm done with everything by 4:45 or 5 o'clock. And I'm in my jammies and slippers really quickly. So it does save a lot of time, which of course I like to use to dote on my grandchildren mostly.